Rising substance abuse has been one of the negative side effects of the pandemic. Malaysia is one nation struggling with the problem. COVID-19 has disrupted rehabilitation programs and even pushed some users to relapse. Melissa Goh reports.
A record year in terms of drug haul in Malaysia. Over $180 million worth of illicit drugs, mainly amphetamine-type stimulants, were seized by the country's narcotics crime agency in the first 8 months of this year, and that's 150% more than the whole of last year. Topping the list is crystalline methamphetamine, known locally as shabu. While the police crackdown has disrupted supply and driven up prices, demand on the streets for synthetic drugs remains high. The biggest problem facing authorities are the elusive kingpins and the extensive network of drug pushers.
They can bribe people. They can bribe all the bosses in agency, in government agency. They have link direct to Laos, to Myanmar, that Shan State. They take you as a pusher with messenger or telegram. So when I arrested you, the police don't know that who is the kingpin.
Doctors at government clinics are seeing more cases of addiction these days, with patients as young as 14 years old.
The usage of amphetamine through online, they sell online, and then they have people to deliver to their houses. This is what I've heard from my patients.
Has the lockdown worsened things for your patients, that some might even have gone into relapse?
Yes. We see some patients, they come back with passive urine for amphetamine, methamphetamine. Unfortunately, we don't have medical treatment for that because it's such an addictive drug. So they can become psychotic, they can start hearing voices, they can become abnormal.
The prolonged isolation due to the lockdown has thrown a spanner in the works for drug rehabilitation in the northern state of Penang. The closure of places of worship has cut off access to spiritual and psychological support for some drug addicts.
The pandemic has really worsened the worst off. There's going to be these different types of explosion, whether mental health problems, whether it is the degree of which they are able to find a new job, and drug dependency.
While it may seem a losing battle, anti-drug enforcement agencies are doing their best with their counterparts from overseas to disrupt the global supply chain for drugs.
For me, if you cannot win, at least you can control. We must control. We don't want all the kingpin control us.
He warned that Malaysia will see more than 2 million drug users in less than 10 years if nothing is being done to curb the scourge. Melissa Goh, CNA, Kuala Lumpur.